everyone. So for this semester's partner project, I did get partner up with a 21-year-old Latino male, and he does live in the Southgate area, which is around Downey and East Los Angeles. And the behavior they were trying to change this semester is to increase their fruit consumption levels. And this does align with the Healthy People 2030 objective to increase fruit consumption in people of 2 years of age or older. The lack of adequate fruit consumption can lead to poor health outcomes because most people get essential vitamins, nutrients, and minerals that they need for normal bodily function from fruits and vegetables. One health concern is vitamin A deficiency, and this is due to the fact that vitamin A deficiency can lead to blindness in some cases, and vitamin C deficiency can lead to a health problem called scurvy, which can lead to anemia, exhaustion, um, as well as gum ulcers and tooth decay. And in the long run, if you do not consume the adequate fruit levels that are recommended, then you can develop different types of cancers, heart problems, and even diabetes. As far as incidence and prevalence goes, according to the CDC, 1 out of 10 people in the United States do not consume enough fruits or vegetables, which means that 9% of the whole population in the United States does not consume enough fruits or vegetables. And in Los Angeles, in total, 12% of the population does not consume enough fruit. And this is according to a study done in 2018. For the same study conducted in 2018 by Los Angeles, they also found that the people who do not consume enough fruit on a daily basis are people who are 65 years of age or older, Asian, and who have an education level that is less than high school, but that is followed closely behind by people who are 18 to 24 years of age, Latino, and who have at least completed a high school education level. And this is exactly where my partner falls into. They are between that age range of 18 to 24 years old. They are Latino and they have completed a high school education. From an ecological perspective, the intrapersonal level factors that have helped my partner change their behavior include gaining knowledge and information about the health risks associated with inadequate fruit consumption. And this has helped guide them in another direction to change their behavior. And at the interpersonal level, they are helped a lot by their dad. Their dad does do the grocery shopping and makes sure to get enough healthy fruits and vegetables throughout the week. And at the community level, well, one thing that really helps my partner is having a variety of options of grocery stores available close to them. And that way, distance to getting to a grocery store is not a barrier. So, in order to increase fruit consumption, the health intervention that I would design would involve the health belief model because most people do go by their own instincts and by their own knowledge and what their beliefs and attitudes are. And I think that the health belief model would help change these personal beliefs and attitudes, which will really push people in the direction to change their behavior because they think that they can do it and they think that they are the ones changing their own behavior. The health belief model does target the intrapersonal level, so anything that is within somebody's own self. And for my intervention, the first activity that I would do is setting up a booth outside of a grocery store that would consist of two health educators. The first health educator would be taking any names and phone numbers of people interested in further help with changing their health behavior of increasing their fruit consumption. And the second health educator would be handing out pamphlets, and the pamphlets would include facts and information that can help them increase their knowledge on the importance of fruit consumption and in order to get them to change that behavior. The second activity that would be part of my intervention would actually go based off of the first activity. So the second activity would include cooking lessons for those people who did sign up and did leave their name and phone number to get further assistance with changing their behavior. So the cooking lessons would show people new recipes and different types of fruits that maybe they didn't use in their usual cooking before, and show them new recipes in order for them to make on a daily basis to incorporate with either breakfast, lunch, or dinner. And this way they are getting a healthy meal and incorporating their daily recommended fruit amount. And the second activity would diminish people's perceived barriers because it would increase their self-efficacy by providing them with tools in order for them to perform that healthy behavior. So the first activity of setting up a booth does target people's perceived seriousness and severity, which would help lead to a change in behavior because it is half of the factors that contribute to people's perceived threat of a certain behavior. So, in order by providing them with the knowledge for them to increase their perceived seriousness and severity, their beliefs that they too can develop a serious health problem will be changed. And the second activity of showing people new recipes will lead to a change in behavior because it shows people that they can be successful in performing a new, healthier behavior. And this is done by showing people that they can do it. And when people think that they can do something, then they are more likely to adapt that behavior.